Congratulations for taking the time to learn more about medications that can help you quit tobacco. Let's face it, quitting isn't easy. The good news is that medications can support your efforts. The not so good news, they are not magic. You still need to do your part. Medications can only do so much. The basic job of these medications is to help relieve you of the withdrawal symptoms, like crabbiness, anxiety, or cravings that you might feel when you stop using tobacco. But what about all the rest of the stuff that makes you want to grab a cigarette or take a dip? Stress? Work? Family? Ugh! Just the thought of quitting can make you feel like smoking a whole pack. Understanding why you use tobacco can help you find ways to stop and stay tobacco-free. You may want to focus on stress reduction skills, weight management, or come up with your own strategies. Kaiser Permanente has an award-winning set of resources that can help you quit for good. More good news. When you use one of our effective quit tobacco programs along with your medications, your chance of succeeding can triple. Check in with your local health education department to see what's available in your area. Okay. Back to the drugs. Having looked at the studies, experts have figured out what many ex-smokers already knew. Yep, the medications work. They also recommend that everyone who is thinking about quitting tobacco should consider using medication to help them quit. This program will give you information about the quit tobacco medications to help you decide which, if any, might be right for you. Choosing what works best for you can be a key to your success. As I talk about each medication, you might want to think about some factors that can help you in making your decision, like, will this medication be easy for me to use? Do the side effects look like something I can handle? Is there any medical reason why I shouldn't use it? You may have other reasons to use or avoid these medications. After learning a bit more about each one, make your own list and weigh your pros and cons. Talking with your doctor may also help. Remember, these medications are a helpful part of your larger strategy for quitting tobacco. They are not magic and don't take the work out of quitting, just the craving. If you're ready, click on the section you want to learn more about. Nicotine replacement therapy uses nicotine to help you feel more in control and less cranky when you quit tobacco. This is also known as reducing your withdrawal symptoms. It might seem a little confusing to use nicotine to get off nicotine, but nicotine replacement therapy actually helps you wean off nicotine over time. Nicotine replacement therapy is safe for most people to use and does not contain the chemicals in tobacco that cause cancer and other health problems. Of course, you can get too much of even this good thing. As with all medications, you need to follow the directions. The patch. The nicotine patch slowly releases a low-level but steady stream of nicotine through your skin and into your bloodstream. The patch is pretty simple to use. You stick it somewhere on your upper body in a spot that is easy to reach. You want to find a fairly non-hairy spot so it doesn't fall off or pull all the hair out. Ouch! It helps if you press the patch in place for 20 to 30 seconds. Yes, 20 to 30 seconds to make sure it doesn't fall off. Most people put the patch on in the morning, and the directions say wear it for 24 hours. Sometimes it can make you have crazy dreams, so some people remove the patch before going to sleep. Remember, those directions also say put on a new patch every morning, but don't put it in the same place more than once every 7 days. After taking it off, fold up the old patch and throw it away, so curious little ones or pets don't get it and absorb the nicotine, which can make them sick. Nicotine gum or nicotine lozenge work by releasing nicotine in your mouth. If you choose the lozenge, place one in your mouth and let it dissolve slowly. Don't rush, and No chewing or swallowing the lozenge allowed. It takes about 20 to 30 minutes to completely dissolve. You can move it around your mouth every now and then, but like I said before, no chewing or swallowing the lozenge because then you won't absorb the correct amount of nicotine to help relieve those pesky cravings. And don't eat or drink 15 minutes before using or while it's in your mouth for the same reason. And unlike tobacco, you can use them pretty much wherever you need. As for nicotine gum, let me be the first to tell you that this is not chewing gum.
Wait, what?
Don't be fooled by the name. You don't just chew, chew, chew. You chew and park. Let me explain. The nicotine in the gum needs to be absorbed by the insides of your cheeks, not your stomach, to work best. Chew a piece slowly until you notice a peppery taste or a slight tingling in your mouth. Then park it between your gum and cheek and leave it there until the tingling is gone, usually about a minute. Then chew a few more times until the taste or tingle returns, and then park it in a different spot. Chew and park, always parking in a different spot again and again until the peppery taste or tingle doesn't return, usually about 30 minutes. Like the lozenge, you can use it pretty much wherever you need. The gum and lozenge work best when you, I know, follow the directions. The nicotine inhaler. It has a plastic rod that you puff on about 100 times. Yes, 100 times, over 20 minutes. This releases a nicotine vapor that is absorbed on the inside of your mouth. The nicotine nasal spray. You use it by spraying once in each nostril. Though it's tempting, don't sniff, just spray. The nicotine needs to be absorbed by the membranes on the inside of your nose, not your lungs. For best results, use the inhaler or nasal spray on a schedule, like once every hour or two, or as directed by your doctor or pharmacist. If you decide to use the nasal spray or inhaler, your doctor will need to give you a special prescription. All forms of nicotine replacement therapy may have side effects, but they are generally mild. Less than 5% of people who use nicotine replacement therapy stop because of side effects. In general, nicotine replacement therapy in any form can cause headaches, dizziness, nausea, and nervousness. If any of these symptoms are strong, or if you feel weak and have a rapid heartbeat, stop using the nicotine replacement therapy and contact your doctor. Always review the package for complete details. Here are the most common side effects of each type of nicotine replacement therapy. Generally, nicotine replacement therapy is safe. There are some situations in which you should not use it. If you recently had a heart attack or have serious heart problems like irregular heartbeat or chest pain, talk with your doctor before using any nicotine replacement therapy. Also, if you are pregnant or breastfeeding, talk with your doctor to determine whether nicotine replacement therapy is right for you. Please check with your doctor before starting any nicotine replacement therapy. As the name says, non-nicotine therapy contains no nicotine.
How's that work?
It accomplishes this feat by increasing the feel-good chemicals in your brain, kind of like what nicotine did for you. There are two varieties, bupropion, also known as Zyban, and varenicline, which goes by the brand name Chantix. Click on the type of non-nicotine therapy you want to learn more about. Bupropion is a pill you take to reduce cravings while you quit tobacco. It's an antidepressant, but you don't have to be depressed for it to work. It does not contain nicotine. Instead, bupropion works to not only reduce cravings, but also to reduce withdrawal symptoms, so you can feel normal even without the nicotine your brain is used to getting. Unlike nicotine replacement therapy, which you start using the day you quit tobacco, you start taking bupropion 1 to 2 weeks before you quit. During that week, the medication builds up in your system and starts releasing those happy brain chemicals that combat the irritability and other not-so-great feelings that sometimes accompany quitting tobacco. After your quit date, you continue to take bupropion for another 6 to 12 weeks, as your doctor instructs. You can take it for as long as 6 to 12 months, as determined by your doctor. Varenicline, also known by the brand name Chantix, is a pill that may reduce your urge to smoke.
How's it do that?
Varenicline does two things. It blocks some of the effects of nicotine, and it activates the brain chemicals that lessen feelings of withdrawal. You start taking Varenicline about a week before you quit tobacco. You may notice that you don't get the same satisfaction from tobacco during that week. Try not to smoke more to make up for it. This is Varenicline doing its job. After you stop tobacco, continue to take Varenicline for about 12 weeks as your doctor directs. Tell your doctor about other prescription and non-prescription medications you are taking, as the dosages may need to be adjusted when you start Varenicline. If you decide to use Varenicline, your doctor will need to write you a special prescription. Your doctor may ask you to try the nicotine patch or bupropion before prescribing Varenicline. Some people experience side effects while taking bupropion or Varenicline. These side effects can range from common and relatively mild to rare and potentially serious. Talk with your doctor about any questions you may have regarding any of these side effects. There may be some reasons people should not take bupropion or Varenicline. The main reason not to take bupropion is an increased risk of seizures. If any of the following apply to you, you may want to explore one of the other quit tobacco medications after talking with your doctor. The main reasons not to take Varenicline include having serious kidney problems or having a history of mental illness. Talking with your doctor will help you determine if this medication is right for you. If you are pregnant or breastfeeding or plan to become pregnant, you and your doctor need to decide whether or not you should take bupropion or Varenicline. In some cases, your doctor may recommend using nicotine replacement therapy and bupropion together. We know that using the two medications in combination can sometimes be more effective than using either one alone. Your doctor may also recommend that you use more than one form of nicotine replacement therapy at the same time. For example, he or she may suggest the patch and the gum, or patch and lozenge together. If you use a combination of nicotine replacement therapies, it's recommended that you stop them if you feel dizzy or nauseous, and contact your doctor to be sure to get the right dose for you. So, there you have it. You've had a chance to learn about the different types of quit tobacco medications. Thinking about whether a medication is easy to use, has side effects you can handle, as well as the possible medical reasons not to use it, can all help in making your decision. Remember, there's more to quitting than using a medication. Remaining tobacco-free for the long term means making real changes in how you deal with the stresses in your life. What's the next step? If you're thinking of quitting tobacco, either with or without medications, a great place to start is by using the resources out there to support you when you quit. Talk with the folks at your local health education department to find out more. And talking with your doctor or pharmacist can help you get the medication that's right for you. You've probably heard it a million times that quitting tobacco is one of the best things you can do for your health. You know what else? The choice to quit and how you go about it is entirely 100% yours. If you decide to quit, Kaiser Permanente is here to help you succeed.